Assalamu alaikum. I am Dr. Sabikun from Bashundhara Ad-din Medical College. Today I am going to discuss about calcium homeostasis. Calcium is a very important micromineral in our body, associated with our bone function and tooth function mainly. But calcium has several other functions. So now I am starting my lecture. That is, calcium is a bodybuilding food, and most of the calcium usually comes from milk and dairy products, and also the small fish and meat also a good source, and nuts also very good source of calcium. So our total body content, calcium content, is 1 to 1.5 kg in adult, and distribution of calcium, if I say about the distribution of calcium, it is 99% of calcium present in the bone as hydroxyapatite crystal, and 0.5% present in the soft tissue, and very little amount, that is 0.1% present in the extracellular fluid. So bone calcium can be classified into two groups: labile calcium pool. This amount of calcium can continuously move from the bone to extracellular fluid, and from extracellular fluid to bone, and stable calcium is stably present in the bone. And labile calcium pool comprises of 0.5 to 1% of bone calcium, act as calcium buffer, present in reversible equilibrium with extracellular fluid calcium, and maintain serum calcium level in acute calcium excess and deficit. As I have said before, this labile calcium pool maintain the blood calcium level, and it's also it always in movable form from bone to blood and blood to bones where it's actually needed. And according to need, actually this labile calcium pool usually form, and stable calcium pool is the 99% of bone calcium, slowly exchangeable with extra. It's also exchangeable, but it shows very slow exchange. So slowly exchangeable with extracellular fluid calcium, and function is bone remodeling. So there is another form, that is ionized form of calcium, ionized form of plasma calcium. There are there are several forms of plasma calcium. These are ionized form, protein bound calcium, and soluble calcium complex with anions. So ionized form is about 50% of plasma calcium. Among these, ionized form is usually active, that is biologically active, hormonally controlled and determined by body calcium status. And protein bound form usually inactive calcium, it is 45%, and soluble calcium complex with anions are the citrate phosphate, which is 5%. All these three forms of calcium remain in plasma in equilibrium to form plasma calcium pool. So plasma calcium concentration is total plasma calcium concentration 9 to 11 milligram percent, or 2.4 millimole per liter, or 4.8 molecular equivalent per liter, and free calcium ion is the 5 milligram percent, 1.2 millimole per liter, and 2.4 milliequivalent per liter. So function of calcium are helps in bone mineralization, muscle contraction, control neuromuscular excitability, helps in release of neurotransmitter, helps in coagulation, and helps in release of hormone. Act as intercellular second messenger in transmembrane signaling. So how calcium act in muscle contraction? At first, action potential in motor neuron triggers the release of calcium ions from the sarcoplasmic reticulum. Then calcium ion binds with the troponin, which is present on actin, and cause tropomyosin to move, and exposing the binding sites for the myosin heads. The actin filament and myosin heads form a cross bridge that is broken by the ATP, and the ATP hydrolysis causes the myosin heads to shrivel and change the orientation. Shriveled myosin head bind with the actin filament, and the reposition of the myosin head removes the actin filament towards the center of the sarcomere, and the sliding of the actin along the myosin therefore strengthens the sarcomere, causing the muscle contraction. So regulation of blood calcium level, if I say about it, there is first line defense usually maintained by calcium buffer, and occurs in level calcium pool of blood. And second line defense usually caused by is known as the hormonal regulation done by parathyroid hormone, active vitamin D and calcitonin. Three organs involved: kidney, intestine and bone. So here I have showed the regulation of blood calcium. So what happened actually? Parathyroid hormone usually act on bone, intestine and kidney. In bone they cause the bone resorption. In intestine they usually passively act as absorption, passively act on absorption of calcium through the activation of vitamin D, and in kidney they actually act as by reabsorption of calcium in the distal comfort tubule and collecting duct. Again, vitamin D have also function on bone, intestine and kidney. In bones they cause the bone resorption, in intestine they help in calcium and phosphate absorption, and in kidney they help calcium and phosphate reabsorption. Again, calcitonin act on bone and kidney. In bones they usually act as by their osteoclastic activity in the bone, and in kidney usually they helps in calcium secretion. So that's how the hormonal regulation usually occurred. সো হচ্ছে যে যদি আমি বলি যে ক্যালসিয়াম যদি ব্লাডে বেড়ে যায় সেই কন্ডিশনটাকে বলা হয় হাইপারক্যালসিমিয়া। এবং কখন আমরা হাইপারক্যালসিমিয়া বলবো? যখন হচ্ছে যে ক্যালসিয়াম লেভেল, ব্লাড ক্যালসিয়াম লেভেল বা প্লাজমা ক্যালসিয়াম বা সিরাম ক্যালসিয়াম লেভেল গ্রেটার অর ইকুয়াল টু 11 মিলিগ্রাম পার ডেসিলিটার হবে। এবং যদি ক্যালসিয়াম লেভেল যদি ব্লাডে কমে যায় সেই কন্ডিশনটাকে বলা হয় হাইপোক্যালসিমিয়া। যখন ব্লাড ক্যালসিয়াম লেভেল লেস দেন 9 মিলিগ্রাম পার ডেসিলিটার হবে সেই কন্ডিশনটাকে বলা হয় হাইপোক্যালসিমিয়া। এবং hypocalcemia manifestations are weakness or tetany, positive Chauzier sign or Vostek signs, laryngeal stridor, and also dysphagia, tingling around the mouth or in the extremities. So that's all about the calcium regulation. Thank you.